All right, good morning, everybody. Thanks for joining us on this Tuesday morning. We were just taking care of some final logistics this morning. Keith is our interpreter along with Jessica Robertson. So normally Mary Fruits is one of our interpreters, but she's actually one of our presenters today. So this will be different for her, probably watching through a different lens. So, and then we have Ronda last joining us as well. So how this is going to work, we are recording this. We have decided to do, to provide this in demand so people can watch it at a later date if they weren't available to join us this morning. So what we're asking everybody to do is to, and it looks like everyone already has, is mute their videos so that it just shows our interpreters and presenters are what will be on the screen. So for those of you, hopefully you're here, we are going to embrace the challenges of assessing a deaf child who has autism. By understanding the co-occurrence, this webinar will help us develop a path to improve our assessment and development of appropriate programs and support services for students who are both deaf and autistic. Mary Fruits graduated from Madonna University's ITP program in Livonia, Michigan in 2001. She moved to Indianapolis and worked 2 years at the Indiana School for the Deaf as a dorm supervisor and educational coordinator. She then moved to Madison in 2003 to work as a staff interpreter for Society's Assets at the Wisconsin Relay to pursue her dream of being an interpreter. After 5 years, she took on the challenge of video relay and has worked for multiple VRS companies for the past 12 years. She has taken on the challenges of freelance interpreting, including medical, post-secondary education, and staff interpreter for Deaf Unity. She was also the executive director for the Autism Society of South Central Wisconsin for 2 years. Mary earned her master's degree in applied behavioral analysis in 2013 from Ball State University, along with a certificate in autism. Mary joined the West Outreach team in February of 2020 as the full-time staff interpreter and is excited to collaborate with the team on their multiple projects. Mary and her husband, Brian, have 3 sons who keep them busy and on their toes. She enjoys gardening, stand-up paddleboarding, playing slow-pitch softball on multiple teams, running a football camp for those on the autism spectrum, and volunteering with her local autism society. Ronda last, for over 23 years, Ronda has worked as a school psychologist in both public and deaf schools. She has helped students of all ages, their families, and their teachers find the understanding and support they need to be successful. Her own personal experience and work with deaf and hard of hearing students provides her with a unique perspective. She recently moved to Wisconsin from California with her husband and 3 children. Ronda is currently the school psychologist for the Wisconsin School for the Deaf. So without further ado, Mary is going to go ahead and share her screen and we will move forward. Thank you, Ronda and Mary, for being here with us today.
Thank you, Heidi, for that wonderful introduction. Good morning, everybody. Welcome to our presentation this morning. Deaf, hard of hearing, and autism spectrum disorder. What are we talking about when autism and deafness coexist? Heidi already gave an introduction, so we're just going to go ahead and get started on our slides here. So first we're going to talk about what autism is. It's on this slide here. I'm going to read it, and unfortunately the interpreters are going to have to sign it while I read it. The behaviorally defined neurodevelopmental disability characterized by qualitative impairments in social reciprocity, nonverbal and verbal or signed communication, and flexibility in thoughts and actions. So we're going to go through exactly what all this means and what it looks like and what we can expect. So one of the first things to remember is that there is no medical test for autism, and that we also want to look for certain patterns of gaps or unevenness in the development of social interaction. So there's 3 parts to autism when we're observing kids, and we're going to look at those 3 different parts: the social interaction, communication, and restricted behaviors or interests. And so we're going to really delve into what autism is, and then Rhonda is really going to delve into autism with the deaf community. So here are the 3 things that autism affects. Again, your communication, which can be verbal or nonverbal. It can include behaviors, or it does include behaviors, and socialization. And children can have a deficit in all 3 of these areas, or one of those areas individually, but it's when we put those 3 areas together that we talk about autism. They can have a social interaction deficit, but not be on the autism spectrum. They can have a communication deficit, but not be on the autism spectrum. And so we can see how when these 3 merge and we have deficits in all 3 of those areas, that's when we start talking about an autism diagnosis. So you often hear the term autism as a spectrum, and often people think of the spectrum as very linear. And in fact, when we talk about the sign for spectrum, we often do a linear kind of sign. But really the spectrum is more of a circle. And the picture on the right gives an perfect example of how autism can differ. There's a saying that we say in the autism community, and it is, once you've met an autistic person, you've met one autistic person. It is very similar in deafness or hearing loss. When you've met one person with hearing loss, you've met one person with hearing loss, and no other person is going to have the same kind of experience or hearing loss that that person is that you have met. And the same thing goes with autism. The pictures on the far right really give you an example of how it can be so different for individuals, where they may have communication difficulties. It might be less impacted, where you have your social deficits are more impacted. And so that is how each person on the autism spectrum is different from another. I do want to say, if you have any questions, please put those in the chat, and then Stacy or Heidi will let me know that those questions are there, and we will address those as they go along. And also we will have time at the end for questions as well. So when we talk about autism, there's a lot of terms out there that you might hear, and so I want to talk about those terms. Autism is a pervasive developmental disorder, and that's the umbrella on the right. And then you have your subcategories underneath your pervasive developmental disorders, which is also PDD. So terms you might hear are autism, PDD, NOS, which is pervasive developmental disorders not otherwise specified, Asperger's syndrome, or it's sometimes pronounced differently, but that's how I pronounce it. And those are all under the umbrella of autism. We used to have the Asperger's syndrome and the PDD NOS diagnosis, and then that changed when the, Rhonda, help me out, the diagnosis number 5, the DSM number 5 came out.
Yes, the DSM number 5, yep.
Yeah.
So when that came out.
So when the DSM-5 came out, they decided that it didn't matter where you were on the spectrum, you have autism. And so it made it easier for insurance companies. It made it easier for clinicians to get payment from insurance companies. It just made things a lot easier in general. And it was like, if you have autism, why give it another label? Just do it. But you're going to also have those labels that people were previously diagnosed with that they're still living with and that they still go by. And so a lot of adults you're going to hear are going to say, I have Asperger's syndrome. The PDD-NOS is not as common, but it's still out there. In fact, when my son was diagnosed, my oldest is on the spectrum, and when he was diagnosed, that was the first diagnosis we got. We got a second opinion, and then he was diagnosed with autism. And so he was on that line. And that was another reason that they got rid of the other diagnoses, is because some people were being diagnosed on one side of that line, and some people were being diagnosed, and that same person was being diagnosed on the other side of the line. And so with a second opinion, you could have a different diagnosis, a different label. And so they said, let's just get rid of all of those. If you have autism, you have autism. It doesn't matter where you're at on that spectrum. There's other things that look similar to autism that are not autism, but they look very similar. And those are the other three that are listed on here, which is Rett disorder, the childhood disintegrative disorder, and Fragile X. I mentioned Fragile X on here, even though it's not on the picture on the right, because often it is a more prevalent diagnosis for people who have autism. They also have Fragile X. And of course, that happens more frequently with boys than it does with girls because they only have one X chromosome. So let's talk about prevalence and statistics. So 1 in 54 children in 2020 in the US will have autism. So if you have a group of 54 kids, one of them in that group is going to be diagnosed with the autism spectrum disorder. And the boys are even a smaller group. So you only have a group of 34 boys, and one of those is going to have ASD. Boys are 4 times more likely to be diagnosed than girls. Autism is the fastest growing developmental disability in the United States, and about 1% of the world has autism spectrum. When we look at Wisconsin, our numbers are a little lower. So we have 1 in 71 in Wisconsin. And you can see on the right, the picture there, it gives you a little more statistics, but one of the statistics on there is that children can be diagnosed as early as 2 years old. I know a gentleman who was diagnosed at 18 months because his symptoms were so prevalent. My son, we didn't realize anything until he was about 2, but he wasn't diagnosed until he was about 3. So that's something else we'll talk about a little bit too, is getting that diagnosis. So let's talk about some of the symptoms that you might see when you have a person who has autism. One of the first ones is sensitivities, and these can include light, sound, taste, or smells. And it can be in varying ways. It doesn't have to be all of these sensitivities, but it could be one or the other. A lot of times the noise sensitivity can be used, can be minimalized with noise reducing headphones. People will wear sunglasses for the light sensitivity. Smells, taste. I had a gentleman one time that asked me not to chew gum around him because that was a sensitivity that he had, was not to chew gum. It was a noise, that noise was like 20 times louder for him than any other noise around him. And so I respectfully spit my gum out. Other symptoms could be an obsessiveness or attachment to an object or topic. So often people on the spectrum know one topic extremely well. They might be able to pull statistics out of their minds that you would never even imagine people could memorize. I put some different pictures on here. I knew a youngster who his obsession was fire extinguishers. And when he walked into Target with his mom, he knew where every single fire extinguisher was in the store, and he wanted to touch them all. Another kiddo that I know knows everything and anything you can ask him about playing the organ and organs themselves. So he can look at an organ and tell you the make and the model and probably what year it was made, and he's a really talented player too. And so it can be anything that's out there. Other symptoms can be a lack of all these things that are listed on this slide. So pretend play, a lack of responding to their name. You may call their name multiple times and they just don't pay attention. And that's what we think, they're not paying attention. Their eye contact, they may not look you in the eyes at all. There are some people who are on the spectrum who say that looking other people in the eyes physically hurts them. And so they may not make eye contact. They might be looking past you. They might not look around. They might look around a lot. Lack of parallel play. So they won't necessarily play next to somebody, let alone with somebody. That was one of the things my son was. He couldn't even stand at a sensory table next to another child without having a meltdown. Turn taking, a lack of turn taking. So they want everything to be their turn. They have a lack of empathy. They don't understand other people's feelings. They may have a lack of pointing or gesturing, which Ronda will talk about later when we talk about children who are deaf. Other things you may notice is that children may be language delayed. And from personal experience, don't ever let a doctor tell you just because a child is learning English and sign language that that's the reason that they're language delayed. They may develop, but then lose the skills that they develop. So some kiddos start to have their first words, but then they don't talk at all. Some have a really bad balance where they might have been developing normally with their peers, but then their balance gets off and they aren't as balanced as they used to be. Tantrums and meltdowns, you'll hear those words used interchangeably. They may have an inability to be soothed or calmed. They might have a very flat affect to their face, so they don't give a lot of expression. A lot of parents will say that's the big change that they noticed in their children, is that they used to be a happy, smiley, go lucky baby, and then all of a sudden they just have this flat affect on their face and they don't really smile any longer. They take things very literally. We say that they're very concrete thinkers. Some of them don't like to be touched. Others love to be touched, and they like the hard, tough, deep pressure touches. So again, it really depends. They may have very rigid routines, and transitions may be very difficult. So this could be transitioning from home to the bus, from the bus to school, from one classroom to another, even inside the classroom, transitioning from story time to let's sit in color, or let's do a lesson time. That could be difficult for them. They may have eccentric ways of walking, so they might walk up on their toes, you'll notice. And again, responding to their name is mentioned here. I want to talk just real briefly about stimming. Stimming is a movement that people on the spectrum will do in order to calm their minds. And so as long as they're not self-injuring, stimming is perfectly fine. And you can see some examples here of what stimming may look like. And these are the kids that you see that are the rockers, the spinners, the hand flapping. My son does this weird thing with his fingers like this, where and he'll do it while we're sitting at dinner. You know, it's just something he needs to do to keep his mind calm, and it's fine. He's not injuring himself or others. And so let the stim happen. Don't try to stop it, because if it's calming their mind, they're in a good place. But if you don't allow them to keep their mind calm with a stim, that's when you're going to get more tantrums and meltdowns and those kinds of things. So it's self-regulation, and it's also in a way for them to express themselves. So we always ask that you respect the stim, because it's very important in their lives. Another really important symptom of autism is theory of mind, or lack thereof. So theory of mind is understanding that others have a perspective and that their perspective may be different than yours. And people on the autism spectrum don't understand this. It's a very difficult concept for them. And so they might only see things their way, and they have a difficult time trying to see things from another way. They might have a hard time understanding that you don't like the same foods they do. Well, how can that be? Everybody likes it, right? That's what they think. They think everybody thinks like them and has the same thoughts as them. And so theory of mind is something that they have to be taught. And a lot of things they have to be taught that we take for granted, that we grew up knowing, that we incidentally learned. These are things that are lacking in their minds, and so they have to be taught these things. Some of the challenges that they might have is additional learning disabilities, or they may have other psychiatric conditions on top of their autism. They may have difficulty sleeping, or they might be oversleepers. So again, it's a spectrum. They might have challenges eating, which can go along with their food sensitivities. Some of them have very limited diets, or they might eat things that they're not supposed to eat. So we have to be very cautious of that. Regulating their behaviors may be difficult for them, and attending to an activity or conversation in an appropriate way are all challenges people on the spectrum may experience. Here's another list of other challenges. I really like this picture on the right, because this is really how an autistic person's mind works. They might hear one little sentence that says, "Hi, how are you?" And these are all the things that they're thinking, and that's going through their mind, and that they're taking in their environment, and that if they have theory of mind, they're trying to be aware of and trying to be conscious of. And so I really like this picture to help people understand where that person's mind might be, and that when you get an answer from that person, it might be delayed because they have to go through all these thoughts in their mind, or it might be something completely off point, and you're like, where did that come from? It's because they've got all these other things going on around them that they're taking in their minds and in their environments. So challenges, we've talked about the sensitivities, the stimming. Echolalia, what echolalia is repeating exactly what they just heard. And so you might say, "What's your name?" And they will repeat exactly back to you, "What's your name?" So they're taking exactly what they're hearing or seeing. It could be a sign language thing too. So they might be taking in those signs and just repeating them right back to you. Scripting is different than echolalia. Scripting is something that they've heard or learned that they repeat later. And they may be applying what they've heard or learned to their environment because that's where it fits in their world. And so that can be very difficult because sometimes you don't understand what they're talking about. I have a perfect example of this. My son, I got a phone call from school one day that my son had taken black marker underneath his eyes and made marks under his eyes. And the school wasn't sure what was going on. So when he got home, I said, "Hey buddy, I heard you made some black marks on your eyes with a marker today. What were you doing?" He goes, "Oh mom, we were in gym and I wanted to show my stripes." Now, if he would have said I wanted to show my stripes to his teachers, they wouldn't have understood what he was talking about. I knew exactly what he was talking about because we had been watching the Little League World Series on TV, and there was a commercial with Tony the Tiger. And the kids in the commercials were taking black markers to put stripes on their faces to show support for their team. And so he wanted to show support for his team in gym, and so he found a marker and he put black marks on his face. Once I explained this to school, they were completely understanding, but none of it made any sense to them. But he was scripting something that he had heard or learned earlier that made complete sense to him for the moment he was in. So that's an example of scripting. And they may script over and over again the same things they've heard. It might be a movie, it might be a commercial, it might be a song, it could be anything. Scripting and echolalia are actually very good. One, it means that they're able to take something that they've learned and applied it to their environment or their situation. So that's generalization, but it also promotes language. I don't think my son's language would have developed like it did without scripting and echolalia. So those are actually good things, except for when they're doing it over and over and over again and it gets on your nerves. But those are the things we have to have patience with. Self-injurious behavior can be, or SIB, can be a challenge. There are some kids out there who have a lot of self-injurious behavior, or they might have behaviors that look self-injurious, but they're really not hurting themselves. It's, you know, they might be slapping themselves or something. They're not really hurting themselves, but to the outside world, it appears to be that way. Elopement is running away, and this is a huge problem for some kids. There are some parents who have to put special locks on their doors, or they have to literally have their children attached to them somehow so that their kids don't run away. Pica is what I talked about earlier, when you're eating things that you're not supposed to. So this is people who eat hair, dirt. You hear about people eating nails. I mean, anything that they can put in their mouth. That's what pica is. Regression can be a challenge, especially for parents who are like, well, my child could do this. Why can't they do this skill anymore on their developmental scales? So regression is a problem. Routine can be a challenge, because if that routine gets thrown off, you might not have a very good day. We'll just say that. And so routine is very important, because people on the autism spectrum like to be able to predict what's going to happen, and so that's why they like routine. And we'll talk a little bit about how you can help them predict what's going to happen. And communication, of course, can be a challenge, which we've already mentioned.
Mary?
Yes.
We have a question.
Wonderful.
How should we approach self-stimulatory behaviors in the classroom when they are interfering with learning? How should teachers redirect these behaviors?
Ooh, I'm going to hand that over to Rhonda.
Oh, thank you, Mary. All right, so it's a very good question. Really, so much of it depends on the situation and how they're learning and their behavior, if they have a behavior development plan. And again, it depends on the states and what they're working with as a team, and maybe a distraction, or, you know, of course, if someone is banging on the table, etc., that's something you want to address. Or if they're running around, if they stay in one place and they're self-stimming, and maybe a fidget or so, you know, I've seen that be successful in a classroom. Trying to figure out what works, of course, to interrupt that stim behavior. Something, and again, sorry again for interrupting, but that's what I've seen work in the classroom.
Redirection can be very useful. Like Rhonda mentioned, with fidgets, or, you know, having them step away from the group so it's not so distracting. So separating them a little bit so it's not as distracting can be useful as well. And again, you want to make sure that it's not self-injurious or injuring others. But I understand how sometimes those movements can be very distracting to the other students. But it's also good for the other students, because they can realize that that person is different, but it's okay too. So sometimes ignoring the stim can be a very good thing, because then the other kids will learn to ignore it as well. And that's just what that person does. Oh, well.
You know, sometimes kids will look and they'll say, you know, like maybe they struggle with that topic or something, like that's the reaction that they're doing if they're struggling. So other kids will learn to maybe help them. One kid that I remember is one student used to flap their hands, and they eventually reduced it to just kind of moving their fingers, you know, and then later on doing it underneath the table. So there are ways to work with the students as well.
Thank you, Rhonda. So now we're going to get into a little bit more of our deeper topic here of deafness and autism. And so we talked about the prevalence earlier in the community in general, but now we're going to talk about deaf children. And there we have a 1 in 53 prevalence of deaf children who are diagnosed on the autism spectrum. The ratio is a little bit more prevalent for boys to girls in the deaf community, where it's 3 to 1, as opposed to 4 to 1 in the general community. And it has been found through research that those with autism tend to have a more profound hearing loss than those without autism. So it's a little more unique in the deaf community than it is in the general community. Hearing loss likely contributes to the delay in the autism spectrum disorder. So often kids, if they have a hearing loss, it's mostly, I don't want to say blamed, but it's mostly, they say, well, it's because they have a hearing loss that's why they're behaving that way. And it might be that they also are on the autism spectrum, but the hearing loss is being focused on first, often because we have screenings where we can find that hearing loss a lot sooner than we can the autism as well. So that's another reason. It has been found that the oral manual approach could delay communication foundation. And again, and I put where we found this information, it was in the International Journey of Pediatric, and I'm not even going to try to say that last word on the page here. You can read that yourself, but this is where these facts came from. And then kids with more profound hearing loss have earlier diagnosis of autism as well. So it could delay it, but it also, the diagnosis could happen earlier. Because of the profound hearing loss, they're already able to put that diagnosis aside and say, oh, there's more things going on than just a hearing loss. So we talk about comorbidity. I'm sorry, yes, Rhonda, go ahead.
I just wanted to add that there is new research coming out right now that sign language is actually really good for kids with autism, regardless if they're having hearing loss or not. So it really helps increase their language skills. So just want to throw that out there.
And Mary, this is Heidi. We
Yes.
have another question. Someone's asking for clarification of what you mean by oral manual approach.
Speaking and lip reading.
Which is impossible.
So, so we talk about the terms comorbidity or co-occurrence. They mean the same thing. You might just see either one of these. And it means just that somebody has a dual diagnosis is basically what that means, that they're occurring at the same time. One of the problems is finding out which is the primary diagnosis. So which is more important to focus on? Is it the fact that this person has a hearing loss and we're going to focus on that? Or do we focus on their autism? And a lot of times there's a lack of research and a lack of professionals who can deal with both. And that's a huge challenge for the deaf community, the deaf autistic community. And you can see here where diagnosis typically happens for hearing kids between the ages of 2 and 3. Deaf kids, the diagnosis for autism happens between 4 and 5. Again, there's that delay in diagnosis. And I want to go back to what Rhonda said about about sign language being good for kids with autism. My son actually, when he was 3 and he was diagnosed, he had 40 signs in his vocabulary, but only between 15 to 20 spoken words in his vocabulary, and he's hearing. So he actually could sign and communicate with us better in sign language at the age of 3. He had that little bit of language. If you met him now, you wouldn't even know. So some of the similarities of autism and deafness. They're both a spectrum. We mentioned this before. They can, everybody's different. You've met one person, you've met one person. Diagnosis occurs later in life, not so much with the hearing loss, but it can be. Again, we have screening tools from at birth that can help with that. So, but usually the diagnosis can happen a little later in life. It's not something necessarily that's found out when they're born. They may not respond to their name. They may be language delayed, deprived, or have language gaps. Stimming occurs in both. You might find deaf children who are not autistic will stim, or people who are autistic will stim. They may have a tendency to play alone, and that's because of communication mostly. A lot of deaf children don't have somebody to play with that can speak their language, that can communicate with them, and so they tend to play alone. And they struggle with theory of mind, so understanding others' point of view. That can be difficult. Challenges that they may have is, again, the later diagnosis in life, especially when we're talking about between 4 and 5, just starting some kind of therapy at 4 or 5 can be very difficult for those who are deaf and have autism. the lack of expert clinicians who understand both sides of both of these spectrums. It's very difficult. There's not a lot of experts out there. They either know autism or they know deafness. They don't necessarily know both and how they can coexist. A diagnosis can be overshadowing of the other, or there may be a misdiagnosis. So sometimes kids are said, oh, well, they have a hearing loss, when it's actually they're autistic, or, oh, they're autistic, when really it's a hearing loss. So sometimes when you're approaching your medical professionals, they might say, well, let's do these couple tests first. Let's eliminate hearing loss. Let's eliminate this. Let's eliminate this. And then they'll get to that diagnosis of autism. So there may be a process to go through. It's not just, oh, that person's autistic. And then schools can be a challenge because you have your deaf schools who really know a lot about deafness, but maybe not so much about autism. And then you have your public schools who probably have more experts in the autism world, but may not understand deafness. And so there's a huge challenge for parents as to which way do I go with my kids, much like parents do with deafness in general. Connecting with families with similar experiences, because the prevalence is, because deaf people are so spread out, as we know, and they might be isolated in their community, and then to have a autism diagnosis on top of that, where do I find somebody else that we can play with, or somebody else who understands my feelings as a parent, or who I can bounce things off of? That can be very difficult. So finding peers, finding the experts with dual understanding. The priority of what do we focus on? Do we focus on social skills? Do we focus on functional skills, or do we focus on academic skills? That can be a challenge for the educators working with these kids. And a lot of the interventions that are applicable to hearing children won't apply to deaf children. And so again, that's where you have your lack of expert clinicians and just your experts in general who can help you. I'm now going to turn this over to Rhonda, who's going to go into more details about the deaf and autistic world.
Oh. All right. Wow, you're already this fast. Okay. So one of the things that I want to explain, remember, we're not trying to, there's not an easy black and white of deafness and autism. So right now, what's nice about having both, you need to have somebody who's trained with both in understanding both of the diagnosis. So the IEP team, okay, the IEP team needs to understand that it's just not written in stone. It's very fluid. So being able to grow with the kid, being able to watch their behaviors and how they improve it, if they're regressing, it's still very new for both deafness, to have deafness and autism. And for any IEP team, it's called an individual education program for a reason. So it needs to be very fluid and work with that specific child. When they are diagnosed with two diagnoses, it's really challenging to look at what their needs are and what is appropriate for them. Following IDEA and following those protocols for the services for students with autism and deafness. So a lot of deaf schools don't have a autism program, so that's not really following the IDEA. And again, it's the same the other way around. So just finding programs that have both of them. I love to see both, or having an autism program that includes the deaf and hard of hearing, or a hearing school that has an autism program and a deaf and hard of hearing program in it, whether it's, and I like seeing some socialization so they can get some socialization amongst other students as well. Okay, so being aware of many different behaviors and looking at those. And I know it was mentioned, I love Mary's slide about the autism spectrum. It's not linear, it's more like a circle. So that person could have a good background, education background, and also I just want to say, like, I've tested some kids, you know, they're very different. Sometimes we've looked at kids at 6 months old and have tried to do some testing. And unfortunately, it's hard to find experts to work with somebody who's deaf and autism. Their skills are delayed because we start thinking of medical evaluations, or they start thinking medical evaluations. I'm married to a doctor and I love him, but all they do is they look at the forms to give out. They have forms for parents to fill out. They don't have different perspectives. And don't get me wrong, parents are the number one expert in their children. They know what's best. But we have to have different perspectives as well, so the doctor can look at all the numbers, because they're only in the doctor's office for about 15 minutes. My evaluations it takes about a good week to do. I really sit down and assess them. I include the parents, the teachers, the kids, that I work with the kids. I try to look at the kids in different environments. So that's also really important. So that's one of the things that I wanted to talk about. I'm looking this over. And the 24 months later is really critical with deaf children, being able to look at two different situations. First, parents are grieving because maybe they are grieving because of they're autistic. And maybe they're grieving because they found out that they're deaf. You know, they were diagnosed with a hearing loss, and then they're afraid that they're not going to be able to have that communication with them. It's not until myself or another expert comes in and says, well, wait a minute, hold on. And unfortunately, with a lot of hearing people, they tend to just kind of agree with the parents, or that because they don't know how to sign, or they usually agree with the medical professions because they don't know how to sign. So it's usually like a 1-year evaluation checkup for screening and other things. And of course, you know, there's more work for the psychologist, but I would like to see kids who have language delays, and how many parents who are not signing with the kids, and how many of them that are communicating with the kids overall.
All right, we're switched. Awesome. Okay, so going on to the next slide. So considering our timeline, yes, and the time. So considering 6 to 12 months relate to recognizing, diagnose that, especially with a hearing child, the research really shows with kids with autism and deafness, there's still some issues and new things that can come up, especially when you're determining when they're learning sign, when they're learning to improve, or the regression, or their language acquisition, from any of these examples that I'm showing here. So again, one of these red flags that they're developing, as they're developing, are they following their chronological age? Are they staying in those percentiles, if you will? And are they signing or not signing? Or if they're not signing, how are they supposed to learn? Or how are they learning? And autistic kids too have a harder time to catch up to that. And then with hearing child, there's no really, with the spectrum of what they're doing, is in considering the behaviors that they're exhibiting, if they're running away, if they're not able to sit quiet in the classroom, they're not a quiet little angel in the classroom, if they're checked out, etc., they may be even doing something like that. And so those are some behaviors to watch out for. Also, their intellectual processes, their developmental age, their behaviors. So those are some harder things, and especially when making a decision on a disorder and where they fall and how they're falling. It's really where my job can become tricky, especially when you're looking at autism spectrum and hearing loss and how their cognitive functioning is showing itself. So again, believe it or not, deaf and hearing kids with autism, they really, they develop with the same parameters as other kids that are hearing and autistic. It's not really separate. Really, we can approach it together as a whole, as the whole child. And okay, now back to what I was going for, learning and receptive skills. And so considering it with the community of educators and considering how the student is paying attention, considering looking where the student has to look throughout their day, the books, the boards, the teachers, an interpreter, anything else, that's a lot of distractions for our kids. Even for a student may, be considering like the physical touch, considering the student's ability to accept that, to stay attention. Is that being satisfied? Is this satisfactory? Is there a different approach that needs to be considered? So they're receptive and expressive skills. As we already mentioned, with an autistic child, maybe their vocabulary development is, as compared to a hearing child, may not be as followed as closely. And so even thinking about someone who's duly diagnosed, their receptive skills, like knowing that like, let's say looking at a picture of a horse and knowing what it is and knowing where it is and what it is in context. For a hearing and deaf child, like, oh, you need to use the bathroom, all right, let's go, those kind of things. Trying to support that, and turn taking, of course, that's another thing that can be worked. Hearing and deaf child, of course, those are things that are workable. With autism layered on top of it, that of course adds its own specific nuances that have to be addressed. And so, of course, I love working with, here's a funny story I'm going to show. A kid was obsessed with, just wanted to keep going back and back to a subject, back and back to, especially like a specific show. And so that's something that a kid can do, and you just have to work with it. And so other patients that I've worked with, so I'm deaf myself. And so really when you're looking at a priority of need, it can be very complicated, especially when working under IDEA and how it impacts kids. It impacts kids' deafness and kids who have autism as well. And so deaf, really providing interpreting services, including that layer of communication needs, it can be such a challenge. So thank you for switching slides, Mary. And so when looking at the approaches, we need to really consider two different approaches. One with looking at how their social skills are, how their obsessions, their ability to engage, maybe a game or so, maybe the person, is it an animal or a person? Is this something that they're obsessed with? Something that can be used to really help the child hone in, and really looking at how they interact even with their parents. Maybe they're obsessed with their parents or a teacher, or that can be addressed as needed. And so the biggest thing is to maintain flexibility in how you're approaching the child. Another thing that I've seen really successful is scripting, maybe looking at a social story, helping the child understand how to interact. And so, again, if they're avoiding people or they're shy, it's not really that case. It's really, if we focus on their communication, it's really a functional skill that really needs to be emphasized and taught to them. And so once they have that, and of course we can assess for that and look at that, look at what's happening in the school, and can approach it. Of course, when you're thinking about where the student is, they're at school all day in that environment, and then they come home, and then the students in their mind, they're thinking they're going to get their food, they're going to get this, they're going to do this, or even simple things like getting a haircut or going to the gym or getting your nails done or whatever. Those things can be quite a challenge for students to experience. And okay, The other thing, when you're talking about communication issues, being able to communicate in an appropriate way, saying like, how are you? And then taking the turn taking. Oh, I saw a cat. It was a white cat on the, wait, that's not really how that goes. So again saying how I'm fine, and learning those social skills. It may be awkward, they feel like they're not in a conversation. That's some things that can be approached, and to try to really pull the child in and engage them. It's really a challenge for them to try to find when working with a child, to find those connections. What things are like really. I've worked with some really good teachers over the years, and you really have to be creative in how you're modifying your lesson plans and modifying the curriculum. And you need to be open as a team to really looking at students, their facial expressions, looking at how they're interacting, how they're taking everything in. And sometimes that may not be as easily seen of a cue. For deaf kids, are they angry? Are they happy? Those kind of things. And sometimes that facial expressions are very important to deaf kids, and explaining that and really setting that up so they're be able to work through real life situations. If they're with a friend, or if they're having an argument with a friend or somewhere, are they angry or are they sad as their friend? And so building those connections as they're able to experience life and learning. And so looking at their communication and communicative competence, there's in my work, really from 3 to 5, really it's so important to develop those communication skills at that critical age. Really, if they're listening, 3 to 5, really they're listening to everything around them. They're taking everything in, and really that incidental learning is so important. And so even if this child is using signs, they will pick up communication ability as they grow, as they develop. But again, it's so critical that age 3 to 5, learning signs, yes, looking at different, this is a lion, this is a cat, this is a cup, these are things, and really emphasizing language, really developing an environment of learning for them. And so even with eye contact, you're thinking of autistic kids, like, how am I going to do that? So if they're looking at a person, or talking about different situations, how to learn to balance. Maybe they need to look past someone to really kind of help maintain the eye contact and really engage if they can.
And Rhonda, I just want to add a story. I spoke with a deaf mother one time who has a deaf autistic daughter, and she told of a story of one time they were in the car and her daughter was looking out the window the entire time the mom was signing to her. And the mom thought that the daughter was not paying attention at all. And so she just stopped communicating with her. Later, as the mom was driving, she looked in the rearview mirror and she saw the daughter repeating exactly what the mom had signed. And so even though the mom thought the daughter wasn't looking, she thought she was looking out the window the whole time, the daughter was paying attention. And there's a perfect example of echolalia in a sign language situation, and the eye contact, that mom thought she had no eye contact with her. So I think that's a perfect example of what you're talking about right now.
Yes, exactly that. Unfortunately, some people don't see that. They see that as like not appropriate interaction. And really, there's so much value in that. And if they can see the value in that and see that communication can happen, is just in a non-traditional way. Thinking about their signing skills, maybe they're not looking exactly, but they're looking. Kids are looking at that age. They're developing the vocabulary. They're looking with their world. And so maybe they're not looking directly at you. And if you emphasize that, sure, but maybe that means something different. Maybe they're looking in a circle, or maybe they're, sometimes we're like, hey, you gotta pay attention, you gotta look. And so we have to think about how we're following communication protocols. We may need to modify those. And so maybe developing some role playing. I've seen that too, working with kids, and maybe just modeling appropriate facial expression. Some kids have such a flat affect. Sometimes it's, of course it's not appropriate for any kid, hearing or, autistic or deaf. And so working with that and developing that, and showing what an appropriate facial expression would be, especially maybe attached to vocabulary. So maintaining appropriate space, the space bubble, if you will, and of course, those are skills that are need to be emphasized and taught. Proper social space. Oh yes, okay. All right, next slide. Yes, so communication. So they can develop sign appropriately, and of course, depending on where they are on the spectrum and their thinking processes. And of course, if they're high functioning, they can really communicate effectively. And so developing communications with students. And so that's where really I see some interventions needing to be put into place. And so you really have to look at how they're developing their language. And so someone who has dual expertise, this is so important. It really can separate what is it related to? Is it related to their ASD or related to are they not getting access to the information by hearing it or seeing it? And so really working with the DOS2 and looking at some diagnoses and looking at how that can be, where that falls on the ASD spectrum, the autism spectrum, and really being able to analyze that. That's really going to help them and help their communication outcomes. And so really you can see here in my slide here, working with kids, really working with the NDOS and the DOS, the ADOS system. And it's not really, we have to really be careful about how we're looking at that and how we're diagnosing kids and how we're approaching that. And so if maybe they're not able to respond to their name, maybe they're not just hearing their name, if they're responding to a wave instead, especially when you're looking at assessing students in their environment. Are they able to look? Are they looking at something? If I'm pointing at something, can they look at it? Considering, working with the child and helping to maintain an appropriate assessment. And so really, if they're not able to focus your attention, maybe there's something else they can focus attention on. You considering alternatives. And also kids with autism or whether they're hearing or deaf, really, so much work and training and looking at scripting and looking things that maybe they're interested in. Maybe if a deaf kid's in a public school, unfortunately we have, you're going to be working with an interpreter besides that, we're working with experts. And you have an interpreter with the students, with their programs. And so of course their interpreters working with them and developing their expressions and showing that. And so when you're working with environments, either at a deaf school or at a public school, considering how they're approached and how it's really a benefit for the student.
And he can't. Yeah. It's not, and it might be, it's not literal learning, just like just hearing kids. So using words such as now, you can't use current, you'd have to use like the more repetitive words that they would understand. So ASL is more of conceptual language, and it's easier to understand. But with reading, we have to use it more with like the literal approach. They have to be able to learn how to read on that. And then depending on their skill of conversation and their level of ASL, we can build on that. All kids learn more literal, but with word signs, unfortunately, we have multiple words for one sign. So we can't generalize the words as much. Being repetitive behavior, the spinning, the waving of the hands, the jumping. We have there's no sense of fear. I know I was testing a cute little deaf boy who was probably about 3 years old. He wanted to climb on everything, and I just kept keeping my eyes on him, like, no, 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 come over here. He was obsessed with water, and I thought he was going to drink too much water. He was jumping from table to table. I had to chase him. I had like 7 cups of coffee. Um, 7 cups of coffee. I felt like I had 7 cups of coffee after working with him. So like having the sign of when he was signing like have fun like a monkey, I was like, no, wait, you're not a monkey. Come back down here. So, all right, IDEA and autism. A lot of people unfortunately overlook this. It doesn't define academic behaviors. We have to provide FAPE for everybody in schools, regardless if they're deaf or hard of hearing or public schools. Everybody has to provide FAPE. And oftentimes I hear the excuses of, well, we don't have this program, or that's very restrictive, or that's not restrictive enough. But for FAPE, with kids that are deaf and autism, we are also responsible and for the development of that child, and we're with them 8 hours a day. So we have ethical responsibility to provide that for our students. IDEA and autism. So they both rely on social interaction, nonverbal communication, and different transitions. We have to put that in the plan for them to become successful in the classroom. All right, the diagnostic tools. There's not one that meets all kids. Psychologists have strong feelings about doctors' diagnosis, medical diagnosis with kids who are diagnosed with these. There are 2 questions. Maybe there's a medical diagnosis form. I'm sorry. The doctors provide medical diagnosis forms, but we don't do that. We do our own evaluations as psychologists. We do educational evaluations, they're functional evaluations. So we really are pretty thorough with our evaluations, and maybe the medical forms will help a little bit. And hospitals and clinics have their own different forms, but they're not experts when it comes to deaf children or deaf children with autism. Sometimes I'll see a diagnosis and I'll look at it and say, this does not really meet the child's diagnosis. So I'll work with that. And remember, we all have to be fluid when it's working with the student. The psychologists who are not very familiar with deafness and autism, it might be easier for them to just push it aside because they don't know, or they're not familiar with it. Or they just say, well, they're just deaf. Well, that's a huge no-no with me. I want to make sure that kids are at their functional level. Okay, medical. I always include the medical evaluations in my report, regardless if I agree or disagree, and I will give my reasons why. My research-based evidence is always included in there. The medical field has a very different philosophy on how to treat deafness, and they're very more of the physical part of it. The educational, we look at the behavioral, we look at the learning, we look at communication skills. Clinics and hospitals and doctors don't do that. There is a benefit for having both perspectives, But for eligibility for special education, that also does help. And just remember, if you guys are looking at a report from a doctor and they're saying that there is autism, ask where the report is, to see if it's a good report, and look at the assessment and maybe find another assessment that would be best for you. Unfortunately, with my job, I have to redo a lot of them, because a lot of them are the standardized tests for autism, and it doesn't really meet with having a deafness. Sometimes interviewing them, sometimes I'd have to interview the interpreters, the EAs, teachers, and everybody, to just see how everybody sees these children, because these guys work with them every day. I just see them maybe once a week, or 1 week just for the test. So it's very important for me to get everybody who works with this child involved. I'm not the only person working on this child and assessing this child.
Rhonda, there's a question in the chat box, and it says, since there's so many similarities, how do you filter through at a young age whether it is the deafness or hearing loss or autism, or the combination of both, especially if there's a medical diagnosis already in place at age 3 when they enter school? How do you filter through the combination of the two, or if it's hearing loss or if it's autism?
Yeah, that's a big thing about deaf ed that I'm really trying to push. A more intervention of 0 to 3 ages, talking with doctors, and talking with the doctor who has expertise in deafness. A school program that has a deaf program in there, and really watching for that, watching for signs. In California, we were very big on that, because we had Lead K, a Lead K program, and they were really big on that. So having the instructors being the expertise on their experts in the children's, maybe doing home visits, talking with the families, having somebody who is an autism expert, and there was a lot of families that didn't have that, which was unfortunate. And then they would have interventions at a later time. So working with and trying to filter this is really going through research centers, and the teachers can identify just maybe not as quickly, or noticing that they're not picking up as quickly. And it's just sometimes, same with the hearing children, they might have a little odd behavior. So just being able to identify that.
Rhonda, one more question that's come up. Is there a list of professionals who have expertise in both hearing loss and autism?
Here in Wisconsin, I would say there's me. I'm sure there's a lot out there, making sure that they work with deaf children. There are some teachers who really don't know, maybe they think that they're delayed because their parents aren't signing as much. And it's really a lot of people making assumptions. But really, we can't look at the what ifs and what is going on at home. We have to focus on what's going on in the classroom as educators. And with children who don't have signing at home and that are autistic, the teachers can really pay attention to their progress. From birth to 3, we really have to look at, how severe maybe they're autistic, or how severe their hearing loss is. We can catch the autism a little faster, so that's a benefit in that in itself. We have to have a trained eye for these kids and looking for specific behaviors in the classrooms. And unfortunately, we don't have that yet. 15 minutes left. Okay. All right. So I have a lot of information, or I've taken a lot of information, the doctor's reports, the research centers, assessments, and there some developmental centers here I've noticed they're overdiagnosing or misdiagnosing. And we have to be careful with that. That's why I do my own assessment, regardless of what I see on paper. And most of the time, most often than not, it's very similar with others. And there have been some disagreements. It's very important to have somebody who's trained with deafness and autism. I don't care if they're deaf or not. They just have to have that deaf education, you know, and have that trained eye. And that's a valued asset to the community. And they need to have a good interpreter with a psychologist to really have a good evaluation and to be able to identify all the nuances. And talking with the IEP team that is aware of, you know, maybe PT and OT and having speech. I know a lot of people think that speech as a student who's profoundly deaf, maybe that's not needed, but it is. Maybe it's for like the appropriate communication skills. It's not always on how to pronounce things or how to say things. It's looking at the language in itself. All deaf students, I think, need to have a speech therapist to look at the language and development of the language. So we need to have interpreters who are very familiar with working with somebody who is autistic, and somebody who is very familiar with deafness and deaf culture when they're working with a hearing psychologist. So we need to have more training in the IEP programs for interpreters and etc. So these are very important, and you would be so surprised on how many files that I get from school districts or other centers, and I get it and I look at all of them and they're testing, or I look at their 30-day evaluation and I say, wait a minute, hold on. The student is autistic? The student is autistic, and people would say, wait a minute, it's not in the reports. And I would say, hold on. Some people aren't happy with that when I bring that up. And they would say, you guys in Wisconsin have a weird law when it comes to a primary disability. And some people think that you can only have one disability. And I'm like, wait a minute, no, you can have a primary, but you can have other primary disabilities. So I'm working with changing on people with that. Switching interpreters.
Okay, everyone switched. All right. So now when you're with your team, it's so important when you're looking at, so important to collaborate with each other. And so even working with school psychologists, come in and say, oh, I know this is how it's gonna be, guys. No, that's not how. That's not it. More of the psychologist is gonna be looking at everything and looking at the whole approach and looking at the whole child and then doing right with the team. And that's so important, especially with the kids, the parents, especially with even a diagnosis with autism, and looking at everything that's happened at home. And it's really developing, really considering their development and really considering their growth. And so really how autism can impact so much of the child's environment and education. So in teaching students and working with special education and working with school psychologists, and really I prefer them to really show up to those meetings. It's so important that they're involved. And so especially when you're talking about placement for students, for example, Some deaf schools will say, oh, they should stay with us. They don't need to be placed elsewhere. And so sometimes that's not necessarily the case. That may need to be involved in an autism program to approach their needs. And so we want to make sure we're doing the best for our kids. And so really psychological assessment, evaluations, the social evaluations, observations that we're doing with students. Also looking at their, are they competitive? Are they able to do what they need to do? Are they able to, looking at the whole child, are they able to take care of themselves, etc. Let's see where I'm at. So many of the things that we're using with kids, especially with autism, and working with school psychologists and working with for the most part, it's a hearing psychologist working with students. Of course, working with students they're not sure about, they're not necessarily qualified to have a qualitative assessment for students and to really, I wish I could do more trainings on norms of a deaf kid, really, and working with that. And of course, deaf kids are not like our hearing kids, especially in how they're learning communication. And really, there's so much that could be done differently when you're assessing kids and assessing it directly versus indirectly. And really, with looking at the different evaluations and like ADOS 2 and those different resources that are available, really developing the appropriate assessments that you have. And really, I've seen some families that sign with their kids and they're really taking off, and at 2 they stop. And I'm like, well, okay. And I've seen that happen with deaf kids as well, where they're communicating really well and then those things end. And so remember that parents, they're the ones who are really in the driver's seat. Really, all of us on the education team are in the back seat. Some of us are in the trunk. We really need to be on board with the parents. And really, they're the ones who are going to be making the ultimate decisions. And we're just going to wait till her screen comes back.
It appears Ronda has a completely frozen screen. We'll give her just a few more seconds. Oh. There we go.
Oh, I'm back. Okay, you guys thought you got rid of me. Okay, I am back. Okay, where did we get lost? Parents know best. Okay, yes, we're everyone in the driver's seat. Yes, yeah, we'll talk about that. Yes, okay, and yes, some of us as educators are really, the parents are the ones in the driver's seat. Okay, yes, and really having everyone in place really helps drive the educational team forward, and having appropriate assessments, looking at medical history, most of it's really social play, looking at how they're doing socially. Are they able to do parallel play with other students? Looking at really key observations that are so important. How do they respond to transitions? How are they learning? How are they responding to communication? Really looking at what's their groove. Looking and seeing, are they friendly? Are they willing to play? Are they willing to leave something they're having and go somewhere else, etc.? Really, are they functioning as someone who could hear? Is that something that's affecting them or not? I think I'm ready to move on to my next slide. Okay. Oh, yes. So we're talking about this again. It's so important that teachers work with, they're with the teachers every day. Well, now maybe not so much with the coronavirus happening now, but again, in typical environment. They're with the teachers, but now with screens, working with 2 kids that have autism and really having them sit and having them look at a screen all day, working with their teachers, with their parents or without the parents' involvement, it's, leading one-on-one learning is a very, very challenging time for us. And looking at their needs and their comfort of being able to access their education. So that's something that we're really looking at, considering communication, and in an environment where everyone is signing, like where I work, having everyone together, that can be very difficult, especially because of autism and working virtually. And so that's an approach we've had to do. Of course, reviewing what you have, looking at educational documents, looking at things maybe you can try differently, looking at what's happened, as what works and what hasn't, and looking at all the reports that have come in. Yes. So are they able to play? Are they able to take in direct interaction? Or are you able to use that? So that I've seen good success with that, and looking at behaviors of kids, and I've known other psychologists that have used this approach, and I've seen it work pretty well. And so again, looking at medical reports, seeing how so the psychologist knows, really they're looking at how to separate how their interactions, their diagnoses, etc. And so they're able to kind of look at the medical side and see how it can or cannot apply to the educational side. All right, so I would like to say too that really looking at their functioning and where they are on the spectrum, their strengths and weaknesses, not only focusing on what they can't do, but we're focusing on what they can do. It's really, those are their functioning skills. So that's included in the school environment as well as the home environment. And a lot of parents tend to really underrate what they're doing at home and how they can take the lead on really helping their students succeed. And it's not just the school environment. So much can happen at home and be supported at home. And really the parents' home environment, your parents, of course, you live with your kids, you want to make it as easy as possible, right? But there's so much that you can do to support your child in their educational and home environment and parallel that. And really developing a plan, really looking at their predictions, looking at how they're able to predict a transition having, or if they are off, what they're able to do, looking at their speech and language communication, absolutely. Looking at evaluating that, how they're, not really their voice, but really are they using their everyday skills? Are they able to communicate on daily communications? What does that look like? And then approaching that. And then also looking at verbal, I have 5 minutes. All right. Well, again, these next slides here have a lot of details for standardized assessments. And so I'm going to maybe try to touch on some here as we go along. All right. So this one. So again, looking at considering students and their experiences. Maybe they've experienced some trauma, or maybe they've experienced neglect. Really looking at considering their environments. They've had abuse, or they've been, how are we going to take care of that? How are we going to approach that? We need to take that into consideration. And we need to look at the development level, not an assumption, but we need to look at assessing where they are at and looking at where their levels are and how they're developing, and what we need to do to support that. Also, where their intellectual disability, their functioning comes into play. We've had some time to talk about it today, really not enough, but really to get into it, really looking at an expert, how they're looking at it, and really that's going to be in their wheelhouse to really look at it. So other assessments that may be used on kids, they can become very complicated, and it takes a lot of patience and heart really you got to look at the results as well as the whole, and really looking at different what the assessments are designed to do. And so I like using specific assessments. And so for developmental assessments, I have those listed in my slides. And so I actually use some of those. I mean, you can use those with hearing kids, but they're designed for hearing kids, but I can use them for deaf kids, but it's just considering some communication modifications if needed. And so it's so important when you're doing assessments. So again, looking at the parents and really communicating that with the parents, and looking at the different tools, the ASD symptoms tool, the autism, the ADOS2 symptoms and their schedule, and looking at that. And so looking at using that to assess a student. And so that can show a lot of, really educational professionals can really collect a lot of information with this. And so the behavior rating inventory that I'm talking about there really looks at their function. And so looking at maybe their speech abilities. And so it really looks at the autism. And so it looks kind of at their whole function. And so looking at considering communications with deaf students, that needs to be paramount, of course, making sure that they're understanding and looking at their behavior when you're doing assessments. So like when you're looking at a hearing child who's born to deaf parents, for instance, maybe they're labeled, hearing with autism, and they respond to their name, etc. And so maybe they respond when they call it the name, or maybe they ignore it. You have to tap them. And so if they have a deaf parent, maybe they're not necessarily going to respond to their name, but they'll respond to a behavior that's culturally appropriate. So those are some considerations to consider when you're giving assessments to students. And so considering, something that may be appropriate for a hearing child may not culturally be appropriate for someone who is deaf. And so that needs to be considered. And so considering, parents who may or may not sign with their child. And so that can be something that needs to be taken into consideration when you're looking at assessing a student, how they're going to respond, how they're respond to someone who's initiating play, or what they should do. Should they sign, or should they wait till they hear you, etc. And really, it ends up being two different classifications. And so, oh, warning. Okay, you need to cut up. All right. I have a couple minutes left. Okay. Again, looking at considering the communication needs for the students when you're performing assessments. Keep the trainings open, and don't limit your evaluations to must be following a certain way. Don't make assumptions either. And so looking at a diagnosis, it's not one diagnosis. You have to look at several really to make sure that they're most appropriate. And so they can be very powerful. And so take a look at, the assessments and the tools and the directions when you're giving those assessments, and looking at the whole child and looking at how they're interacting, and consider those communication needs and be sensitive to that. And so, if it doesn't work out, that's okay. There are a lot of other things. And so we're going to be switching interpreters here.
All right, I'm done. Mary is telling me I need to shut up. So anyways, just making sure that, we go through the assessments and be very thorough with our assessments. That's to make sure that we're giving the FAPE, the free appropriate education that they need, and because kids are impacted with this as well. As far as the DHH program, I think it's wonderful. And having those autism students to be involved in that program as well. It really can measure and see how much the autism program could really benefit deaf and hard of hearing kids as well, because there's a lot of pros and cons for both programs, you know, and some people say, well, they're deaf, they need to just be in the hard of hearing program. From my experiences, it's teaching them how to sign. I want them to learn how to sign in a safe environment and not when they're 18 and out into the real world. That's not really fair to them. Okay, I'm so sorry. I will stop right now.
Hey, Rhonda, this is Heidi. I'm going to have you expand on the question that came in just a little bit earlier. So it comes where Teachers for the Deaf and Hard of Hearing, for children who are identified with autism when they're in birth to 3, they have a medical diagnosis. So they're entering the school system with a medical diagnosis already, and nobody with experience working with children who are deaf and hard of hearing. So it could be that they do have autism, or it could be that they don't have autism, but then our Teachers for the Deaf are sort of like feeling like they have to educate the autism team on why it's maybe not autism and it's really maybe the hearing loss. So how do they sort of do that dance around experts in autism and saying, maybe your diagnosis is incorrect?
Well, you can talk with the IEP team and you can say, like, you are right, they are deaf and they are deaf and that is a disability. But from my experience of working with typical deaf student, you know, this isn't consistent with other deaf children. You know, they cannot deny an assessment. So you can recommend to the parents, ask for more assessments, and the parents could have that in writing. And the school district has 15 days to respond to that. And then after the 15 days is up, they have 60 days to do the assessment. It's legally required. And if they do not follow that, then you can go up to the district level or, you know, the legal counsel. Sometimes you do have to go through that route because it's there are some psychologists that are not comfortable doing an assessment to a deaf child because they're unfamiliar with deaf children with autism. So we need to find the people who are interested and who are motivated and who have the experience to really figure out. And the interpreters are so critical because, like Mary was saying in the evaluation, you can have a hearing psychologist. That's fine. If it's a new a new interpreter with a psychologist is not the best way to do it because it's going to be very confusing. But if you want to use a new interpreter, that's fine. Make sure you train that interpreter before the assessment, a couple of days, 2 or 3 days, and let them know what you're looking for, how the words are going to be used. And sometimes, unfortunately, the interpreters will get the wrong answers. But remember, the interpreters are not, you know, answering for the child. They're just answering what they're saying. So sometimes it's people have over empathy with that and say, like, this is what they mean. You can't do that. You have to give what the child is actually saying. And same with the psychologist. They have to look past their, you know, their experiences with the deaf children in the past, you know, and thinking, well, they can't hear, so we're not going to do this test or this assessment, you know. We still have to use that. We can still use the verbal assessment, but with sign language. I'm sorry, but you do have to do the dance, and it's a hard dance. And you will upset some people, but it's because they just don't understand. It's the only way that they can understand is to really get it through their heads and keep saying it. Unfortunately, you don't want that kid to start elementary school or middle school diagnosed with autism and then looking back and they don't have it, you know, and think, what have I done? I've seen a lot of teachers quit or walk away because of the guilt. They haven't been, you know, they didn't catch the problem sooner. You know, and sometimes it was unpredictable. Remember, when they're little, it's easier to manage. when they're older, it is more difficult. It starts becoming, feels impossible. So it's really important to catch it at an early age.
Thank you for expanding on that, Rhonda. This is Heidi. We do have a question around primary disability. So when you're looking at the IEP and you have a student who has a diagnosis of autism and you also have an identification of deaf and hard of hearing, how do you choose which is the primary, air quotes, handicapping condition? Do you pick which one is more functionally impacting or academically impacting the student? How do you prioritize that?
It's interesting that you say that, because that is a constant issue with special education, and that's where I make my money. Trying to figure out what is the higher impact with deaf kids, and if they can't hear, and if they can't hear. So trying to figure out, like what the more facts are, which one is the primary and what is the secondary. Sometimes it is a struggle. Sometimes it is the autism is the primary. It's same with ID. It's so hard. You have to look at the functioning skills and the assessments. And of course, with, in my perfect world, having a teacher who is trained in deaf and hard of hearing and trained with autism, that the kid would flourish. But we don't always have that. Because of the districts like to have the labels and put down what is primary, really they have to be a little bit more flexible and open to the idea that the deafness, yes, medically they are deaf, but maybe that doesn't impact their education. Education has nothing to do with it. Autism is the entire picture. And unfortunately, because they can't hear, they add that as the second one. But the autism is the primary one. And they might think, wait a minute, they're deaf first. And you have to tell them, no, they're autistic first. And then their second diagnosis is, that they're deaf and hard of hearing. You have to have this discussion with them, and yes, they might, have ED as like their first primary disability, and then maybe having like an interpreter because of their second disability, looking at their behavior as well. It really depends on the situation, and that's why it's called an individual education program, an IEP. So it's not a one size fits all.
This is Heidi. Thank you for expanding on that, Rhonda. And I know that this is Heidi. I am participating on a DPI work group, and I know that their big push is moving away from label-based services and moving more toward needs-based services. So of course, our students need to be, we still require them to have a label, but it's just important, I think, in the conversation is the needs-based. So looking at the whole child and writing the IEP to meet the needs, regardless of whether it's deaf and hard of hearing or it's autism, it's what does that individual student need?
Right. And I agree with you. And unfortunately, they're looking more of like, like the learning disabilities. They're looking at the portions to identify them, regardless if they're deaf or hard of hearing. So I do agree. And more severe disabilities, we do need to label them and have those services for them. And the educational design, the educational system is designed for students in general and not really designed for special education. So we see a lot of students that struggle, and that's just like in the history of time, and I've worked for 23 years, and instead of, arguing all the time or, I try to understand, and I try to explain one size doesn't fit all. And there are some reasons that we do have some diagnoses and some labels, because that will help us work in a different path working with that child.
Perfect. This is Heidi again. So what are some typical classroom modifications or services a deaf child with autism should be receiving or we should be considering when providing support?
In my dream world, I would like to have somebody who is an expert and trained, not just working with deaf children, but deaf and autistic children. We don't have that yet. But I would actually like to have individuals maybe who have kids who have language skills, more social skills, or less. It really just kind of depending on each student. So in the public world, I want them to be successful as well and teaching them how to function out in the real world, you know, and we want to protect them as a whole. And we have a small percentage of kids that we do protect that cannot function on their own in the real world. But that is a very small percentage. Most of the percentage of deaf and autistic children, they can succeed in the world, and they don't succeed sometimes because of the barriers that people are putting there for them, but they are able to succeed if they were shown that. And unfortunately, in the public world, they have to see it in order to believe it, and then to accept it. And that's really where I think the biggest problem is in the public world. They have, people with disability, but I personally don't see autism or deaf and hard of hearing as a disability. And I know that my brother-in-law actually works for the government, and he has severe autism, but he is amazing when it comes to numbers, and he is a hard worker, and he always is accurate with his work, and the people that he works with love him. And at first they thought that he was a little different, but now they can't live without him. So, that is one thing that we need and we need to look at what their skills are, because some of their skills they're just amazing with. And we have some deaf and autistic kids who can be successful, and they do a wonderful job, and they can be wonderful workers, employees, and we want them to be successful. There is one big gift, and one big gift that parents could give their child is that they can do it, and not telling them that they can't, because there is a very small percentage that can't function in the real world. So just teaching them to be independent. If we do that, they can outsmart the disability.
Mary, I'm going to also expand that question over to you a little bit with your involvement with the Autism Society. Do they have like website resources that just talk about sort of general, because like you said before, if you've met one autistic person, you've met one autistic person. So one size does not fit all. Is there sort of a general resources on their website that may talk about accommodations and modifications that support individuals?
Yeah, thank you, Heidi. Actually, this was our very last slide that I forgot to share, but this is the Autism Society affiliate map here in Wisconsin. Now, they may not be experts like Ronda and I were talking about with deafness and autism, but these are the autism experts. And so these are the different areas around the state who you might want to contact for more resources. They do have websites. So if you're looking at the map, the lower part that's orange, that's Autism Society of South Central Wisconsin. Then the lower part that's red is Autism Society of Southeastern Wisconsin. Then all the other colors, they do have separate affiliates, but they're all thrown into one group, which is the Autism Society of Greater Wisconsin. So you're going to find 3 different main affiliates in the state of Wisconsin, and those are, but there are sub-affiliates under the Greater Wisconsin one that specialize in their areas a little bit more, and they all have different events. And when we're not in a pandemic, they have social times and support groups and all those types of things. And they can also lead you to, if you feel a child needs to be diagnosed, where in your area you can get diagnoses, who can do those, psychologists or companies. There are a lot of companies around the state that provide, a lot of people go to the Weissman Center in Madison. Understand there is a long wait list typically for them. You might be able to get a diagnosis through some of the other companies a little quicker, but so this is the best place to go if you want just more information about your area, or information about more just general information, I guess I could say. So that's the, I was hoping to share that slide. So thank you, Heidi, for asking me about that.
Yes, sure, of course. And so would they also be able to provide insight on just general accommodations to consider for students who have autism? And then, like, as a teacher for the deaf and hard of hearing, they may pick and choose what specifically works for a student.
Right. What I would recommend is, yes, they would be able to have some different suggestions for accommodations for an autistic person in general. And then, as Rhonda was saying, because everybody's so individual, work with the parents, work with any other professionals they may be receiving services from, which could include a speech pathologist, an OT, a PT, or a behavioral therapist, which is another huge service that people on the autism spectrum might be receiving, is behavioral therapy. Work with all of those professionals, make sure that you have those ROIs signed for everybody to be able to share information, because the more information you can share, the better resources, and the outcome is just everybody's communicating, and they're really, the goal is the child and what their needs are, and making sure that their needs are being met. And it looks like Rhonda wants to add something.
So I wanted to add, so even behavior specialists, you know, that could be involved in that team. And so they could help direct the educational team, the teachers, you know, to figure out how to assist the students and what could work and what different ideas, and compare notes and how to assist them. And so different reinforcements that could be in place. And so, you know, not necessarily considering when you're considering. Yep. So with like religious signs, etc., but religious organizations, but general frame organizations can definitely assist.
And this is Heidi. So Mary, I just sort of sent you a little private chat too. Is the Autism Society a national project or national programs? Because we have several people who are joining us from out of state. So does each state have, okay.
Yes, there are. There's affiliates all over the state. Some states like Wisconsin have more than one affiliate. There are other states that there's one affiliate for the whole state. There's multiple affiliates in one state. There may be some states that don't have an affiliate that you'll have to go to your closest metropolitan area. But yes, it is a national society as well. And I like to think of the Autism Society when we think about deafness, and we have the medical viewpoint and we have the cultural viewpoint. I like to think of the Autism Society as the cultural viewpoint. We're focusing on the person. We're not focusing on the diagnosis. So we're looking at the person's needs, what their strengths are, and really emphasizing those strengths and making them become a more functional and person in the community. So that's why I refer to the Autism Society amongst other organizations that I won't name.
Thank you for clarifying and expanding on that. We have for sure one more question in the chat. Would you recommend sound
I do have Rhonda wants to say something.
Oh, sure.
Yes. So with mentioning those programs, unfortunately with programs with deaf and hard of hearing programs, supporting both, it can be a struggle, it can be hard. But again, I am hoping for more support. And of course, depending on where you live, rural programs versus suburban and, you know, mid-city, et cetera, those things, it depends on availability and collaborating with different teams. Of course, they may have their own ideas, but that's something to consider.
Perfect. Thank you, Rhonda. So the final sort of question that I see in chat anyhow is, would you recommend sound sensitivity training for students who have ASD and hearing loss if they struggle with sounds?
Yes. So again, it depends on the child. Sometimes kids who like to throw, maybe pound a table or something, or et cetera, or hit something on their way, or use that as to make noise. Again, that's something that could be redirected or retrained with sound sensitivity, of course. If it doesn't affect the other kids, then maybe it's not much of an issue. But again, maybe working on some calming techniques to help calm the behavior or redirect it. Maybe we're looking at different weighted vest or blankets, maybe something on the table, or maybe encouraging the behavior under the table. So if it's not noise, then it could be redirected in that way. So yeah, that could work.
And to add
Mary?
to what Rhonda was just saying, some kids, their stim is making noise and it is calming for them to have noise. Some of them want that noise. And so that's when we have to teach them the functionality of life, is that, well, that's not what everybody else wants. So we're teaching them theory of mind, we're teaching them perspective, and helping them understand that, yes, this is great for you, but it might not be great for everybody else. It's really sticky. It's a process. It's something that might take some time, but again, you want to work with the student and make sure that you're trying to understand what that noise, if they're making a noise, what that noise is doing for them. Is it a stim that calms them, or how is that functioning in their world? So not only them having theory of mind of us, but us having theory of mind of them.
I want to clarify that question too. They expanded a little bit, the person asking the question. They're saying not about them making sound, but when they themselves are sensitive to sounds, so you'll see students with autism that if a sound comes in, either like that they have an aversion to, or if it's all sounds like a certain threshold that they can't handle, do you recommend sound sensitivity, like sort of a therapy where you're introducing sounds to try to get them used to the sounds? Or do we just recognize that they can't adapt to that sound or to those sounds, and so we use noise canceling headphones, for example? So do we provide sensitivity training, or is it better just to accommodate them?
Oh, yeah, it really depends on the kid. Sometimes that works with the hearing, having the headphones. But again, if that's a sensitivity issue, that may affect them too. If a bell's ringing or something, maybe have, explaining what that noise is. If it's a fire drill, etc., then kind of helping them work through that to know, okay, that's what that noise is. Explaining is it an awareness of not knowing what it is, or is it the sound itself or a threshold? The other thing, when you're assessing students, of course, that could be a separate issue entirely, but with deaf kids, maybe they have a vocal stim, or hearing kid, or those things. An interpreter who is working with a student, if they're working with a professional, it's so important that the professional is cued into those little nuances, or even grinding their teeth, those kind of things that I, as a deaf professional assessing someone, I need to know if they're doing that. I may not hear that, but those are things that a team assessing would consider, and trying to figure out, is it a comfort for them, is it a response? Yeah.
And also, predictability is so important. And when we're talking about sounds and sensitivities, if you know sounds that are triggering for the student, if you know they're coming up, like a fire drill or like a whistle blowing at recess, or those kinds of things that we know that those are triggering, help that child predict that those things are going to come. For my son in elementary school, they always made sure they told him there was going to be a fire drill that day. If it was a planned one, they made sure they told him, and they made sure they told him what time it was so he could put his headphones on himself, and then he could predict it. That could sometimes be a curse too, because if that fire drill doesn't happen at that exact moment, that might cause anxiety and really get them worked up as well. But prediction can also be important. So if we know these sounds are coming, we can work on those skills as well and help them along the way. So really just, again, meeting their needs to help them stay in a state where they can still learn in their environment is really the most important for the student.
Yes, and to add to that, also with a school district that I've worked at, considering a buddy system, et cetera, for them if something were to happen. Working with some of the other classmates, in the mainstream classroom, the students are often there. The autistic students are often in the classroom with the regular population. So maybe having a buddy, if there's an alarm system, look to this buddy, look to, hold this person's hand. Or if that's something that they can do, again, instead of it being an adult, having one of their peers working through that. And so maybe making sure that buddy, you're always with, Johnny or Joe or something like that. That could be something that would work too.
We did have a comment. Someone sharing that they've had success with allowing the child the option of sitting on a physical therapy ball or a chair during class. The ball allows movement while sitting at the desk and focusing on work. So, yep, again, for some students that works great. It is definitely, you guys are really sort of hitting that target when we talk about the individual needs of the student. So recognizing what the needs are for the student to be successful in the general education curriculum, and not just general recommendations that we might think apply to all students with autism, for example. Mary, just before you, I'm going to have you comment, but I just want to say quickly too that there is a form that we just have a link to if you want CEUs or certificates of participation. We're asking people to just click on that link and fill out that form and submit it if that's something you're looking for. I just want to put that in there before I forget. So Mary, go back to your comment.
Sure. The one thing I just wanted to comment is they can adapt. These kids are very adaptable. They just need to be taught how to adapt, because these are skills they just have not learned. One of the things we've learned to do with my son is when he's doing something that's not the right time or place, that is a phrase that I have taught him, time and place. And when he hears me say time and place, he knows whatever stim he's doing that's not appropriate at that moment, or if he's singing in the middle of Walmart or whatever he's doing, not the time or place, he hears that and he knows that he can bring it down a notch, that he can maybe lessen it. But this is stuff he's learned over time. So it's not something that's going to be taught overnight. I mean, he did therapy for 8 years. And so, I mean, it's a process. Patience is so important, and repetition, and patience and repetition, because really you can get these kids to function in the world and be members of our community. We just have to keep working with them, and sometimes we're going to give and sometimes they're going to give, and sometimes it's a struggle between the two. You're going to have that power struggle sometimes, but be patient, keep with it, and I promise these kids, they'll adapt. They will. They're really awesome if you get to know them too.
I think that is the perfect way to conclude our webinar today. It is at 11 o'clock. I want to thank everybody again for joining us. We will be posting these to our Canvas community, the slides, and we will eventually get this captioned and posted to our YouTube videos. So this concludes today's webinar, and thanks to everybody for joining us.